All right, good afternoon. Thank you for joining us for our weekly briefing. We're joined with Dr. Michael Mendoza as well. I'm going to start off with a few brief remarks and then turn it over to Dr. Mendoza. As you can see from our daily reports, we are continuing to see record high new positivity cases every day. Yesterday, Monroe County reported 625 new cases. Also yesterday, the hospital systems had you heard from them on their capacity needs, and what you've heard is that our hospitals are starting to fill up and that COVID is having a real impact on staff shortages and staffing needs that we need in our healthcare systems. The message around this could not be any more clear. Either we're part of the solution or we're not. We can either choose to wear our mask, maintain social distancing, and limit our gatherings to under 10 people or less, or not. And we all have a duty to work together to flatten this curve and to slow the spread of the disease across the community. We need total community support and community buy-in to ensure that our hospitals are not overwhelmed, the businesses can stay open, children can remain in schools, and the public health of our community is not further compromised. Does the guidance work? Yes. We see it every day and every week in the school systems, which is why when they went through a testing program in the yellow zones and then into the orange zones, we knew, because we could see through the contact tracing and anecdotal evidence, that the spread was not in the schools. They did the testing and it proved that the spread was not happening in the schools. And the question is why? Why is it different in the schools than it is community-wide? And the difference is because our schools are following the protocols. The desks are separated 6 feet apart. The kids go through a health screening with questions before they're allowed in the building. Temperatures are taken. Hands are washed and masks are being worn. It's a clear sign that the guidance works, and if we can do what they do in the schools around the rest of the community, we'd be in better shape. And so I'm asking everyone to please do our duty. Do our duty to the hospital systems. Do our duty to our friends, our neighbors, our small business owners who are struggling right now, to follow the guidelines, wear our mask, and get through this. We will get through this. If you think about where we are in a running race, we're about 3/4 of the way through the race. We can see the finish line. There's a vaccine on the horizon, but it all comes down to the success of a race, all comes down to that last quarter of a mile. And we are there, and we do not want to stumble at the finish line. This is the time to double down, accelerate our efforts, and get to that finish line, get to the point where the vaccine is here, and that we can get back to a new semblance of normal next year. But to do that, we have to work together over the next couple of months to bring our numbers down. Earlier this week, we announced targeted asymptomatic testing in the orange cluster zones in the areas of Rochester, Aroniquoit, Brighton, and Gates. The town of Aroniquoit completed their first 2 days of the initiative on Tuesday and Wednesday. They tested roughly 550 people over the 2-day period and helped to identify positive cases of people who are asymptomatic and could have unintentionally spread to others throughout the community. And just yesterday, Monroe County and the city of Rochester announced a full slate of community testing throughout the month of December at 4 locations. East High School, located at 1801 East Main Street, is going to operate on December 5th, December 12th, and December 19th from 11 a.m. to 2 p.m. Benjamin Franklin High School on Norton Street will be on December 7th, 14th, 21st, and 28th, which are Mondays from 3 to 6 p.m. Joseph C. Wilson Magnet High School on Genesee Street will be the next 4 Tuesdays, December 8th, 15th, 22nd, and 29th from 3 to 6 p.m. And Jefferson High School on Edgerton Park will be the next 4 Wednesdays from 11 a.m. to 2 p.m. December 9th, 16th, 23rd, and 30th. In Brighton, Temple Brith Kodesh on Elmwood Avenue will be on Tuesdays and Thursdays starting next Tuesday, December 8th from 2 to 4 p.m. The Aroniquoit Department of Public Works will be on Tuesdays and Wednesdays from 5 to 8 o'clock. And in Gates, the Gates Memorial Park on Spencerport Road will be open on Wednesdays from 4 to 7. To sign up for these testing, Monroe County has built a pre-registration portal for anyone who's looking to visit the rapid testing locations. You can pre-register at monroecounty.gov/COVID test. Again, it's monroecounty.gov/COVID test. You simply click on the link. It will show you where the testing locations are. and what time slots are available. So it could not be easier to use. Also this week, New York State announced today that they're expanding their capacity at the MCC testing location. They are now up to 4 lanes available, doubling their current availability, and will have an immediate increase in capacity to over 1,000 tests per day. Again, to register for that COVID test at this location, you can visit, again, our website, links to the state website. So you can go to monroecounty.gov, you can go to COVID-19 screening.health.ny.gov, or call the hotline at 1-888-364-3065. We really appreciate our partner support at New York State for providing this location and for providing the rapid testing kits for our new asymptomatic locations. And I again want to thank all of our municipal partners for working with us to set up these test sites in such a short amount of time. I think that with the increase in the number of testing and the testing availability is a good thing to help find these cases in the community, get people isolated, get people quarantined before they can spread to too many people around them. So I would really encourage this community to seek out these testing sites and take advantage of them. To help with our COVID rapid testing initiative and other tasks that are part of our COVID response team, we recently announced about a week and a half ago the creation of 50 temporary full-time COVID health clerks. With the continued increase, though, in new cases and our continued focus on public health of our community, we recently received approval from the Civil Service Commission to create an additional 100 COVID health clerk positions. Again, these positions are part of our COVID response team, will be available immediately, and they will help with tasks such as data entry, registering people at the rapid testing locations, following up on isolation and quarantine orders, contact tracing, and various other tasks for the Department of Public Health. These are critical positions that are necessary for us to respond to this growing increased number of cases and make sure that we can protect our community. Again, go to our website, www.monroecounty.gov, if you're interested in applying for any of these positions. We've been able to create these positions thanks in part to our mid-year budget adjustments to the 2020 county budget that we've talked about on numerous occasions. We have asked our county departments to work with us on a soft hiring freeze, cash capital freeze, and other department level cutbacks across county departments. By effectively doing that and managing our revenue decreases and also managing the budget, we're able to now bring on these additional help to help us respond to the COVID-19 crisis. So I want to thank all of our county departments for their work with us to make sure that we have this flexibility within our budget to be able to hire these positions. As we look ahead to the 2021 year, the 2021 budget, which I recently submitted and will be voted on by the county legislature next Tuesday, we are in a position to continue to carry over those same adjustments that we have in place now, so that it will give us the flexibility that we need to continue to respond to this pandemic. We look at the budgets as a multi-year endeavor right now. We can't just look at this year to year. The pandemic obviously crosses calendar years, and the pandemic is something that we need to respond to with the full force of our county government. And so we are looking at this as a 2-year budget cycle to have that additional flexibility in our county budget to help us adapt to the changes, adapt to the public health needs of our community, to make sure that we are at the forefront of the response as the need arises. So again, monroecounty.gov to apply for those jobs and help us in our response to COVID-19. With that, I'll turn it over to Dr. Michael Mendoza.
Thank you, County Executive Fellow, and thank you again to all of our media partners who are joining us today. You heard a lot just now about all of the work that is happening across our community to combat the crisis of the COVID-19 pandemic here in Monroe County. You heard about the expansion in testing at MCC, asymptomatic screening locations hosted by our towns and villages. Many, many hours of volunteer often work is going in to establishing all of these opportunities for all of us to get the tests that we all would like to get. Our schools are working nonstop to keep our kids in school, to undertake all of the testing that is now being required of them in the orange zone and potentially later. All of our hospitals and all of the staff working in the hospitals are working very, very hard to keep our loved ones safe and healthy, to discharge them safely back to their home or to their nursing home, so that we can create capacity and maintain capacity for the surge that is going to be coming to our community later this month. Many social service agencies are working very hard to ensure that social services are being delivered to all of our residents who are in need, whether it's food or shelter or other services. Many, many opportunities across this community of examples of people working together, doing what they can to help one another. The one feature to all of that that's missing is the rest of us. And I ask all of you, what are we doing to help all of these agencies and people and governments and municipalities? What are we doing to help them out? At the end of the day, we need to work together. We need to change our behavior, because if we don't meet all of these other agencies and groups and municipalities at least halfway, we will not find a safe and healthy way through this pandemic. Unfortunately, today we will be announcing yet again another record number of new cases, 654 new cases here in Monroe County. And very sadly, we are going to be also reporting 19 new fatalities. These fatalities again span a period of time from November 23rd to November 30th. But these represent very clearly loved ones, family members, neighbors, fellow citizens here in Monroe County. We owe it to them, to their families, and to their loved ones to do everything we can to flatten the curve. The curve refers not just to beds and ventilators in the hospital, but it refers to the capacity represented by the people, the nurses, the respiratory therapists, and the doctors who stand ready, though tired, ready to take care of us in our time of need. So with that, I want to end simply by saying what I've said all along. Please wear your mask. Please maintain your physical distance. Please be thoughtful about who you're gathering with. Now is frankly the time to stop gathering outside our household. With all of these steps, we may not be able to totally flatten the curve right away. It will take time, but I will say that we must undertake these steps in order to get through this very difficult time. With that, I'm going to hand it back over to Adam and Julie.
Okay, we'll start questions. We'll begin with Mary McCombs with Spectrum.
Hi, good afternoon. My first question is regarding the logistics on the vaccine that we're hearing about. I know one is at room temperature. We're hearing a lot about cold storage. Do we have a plan in place to properly store this vaccine?
So there are a number of vaccine candidates. The Pfizer vaccine is very likely to be the first that New York State will see. It is the vaccine that does need to live at quote ultra cold temperatures, and that is not just a typical freezer. That would require a freezer that our hospital systems have. So we do have capacity to store all of these vaccines at our hospital systems, and then from the hospitals that will serve as the hub for distribution to the various sites across the community where the vaccine will be administered. Now, the first wave of vaccines that come will actually not likely be enough to even satisfy the first tier, which is healthcare workers, long-term care residents, and long-term care staff. That'll be the first tier of individuals who will be eligible for the vaccine. So largely speaking, the first wave will be administered in healthcare settings, but we are already planning to look ahead to the next phases, tier 2, tier 3, and ultimately the general public.
Okay, my follow-up question would be, I know you've addressed the private gatherings as an issue, but could you perhaps expand a little bit more about living room spread and how we mitigate something like this?
Well, Mary, I'm sorry. Well, I'll start. This is how we mitigate it. It's if you are in your home and with other people, you have to wear your mask. We're asking people not to do that, though, to keep our in-home gatherings as small as possible. And to really go back to what we learned earlier this year when the virus first struck our community, which was to keep our in-home gatherings as small as possible, and to wear your masks when you're around people who are not inside your immediate household. It's the same guidance that you would have if you're out in public. You have to wear your mask. You have to stay separated by a minimum of 6 feet. And that's, if we can do that, we'll slow the spread of the virus. You know, this is what, and the time frame for this too is, if you look at this, and this is why I said, you know, make an analogy here to a race, right? We're running a race here. We're about a quarter mile from the finish line. We can see the finish line. There's a vaccine on the horizon. It's going to take months, It's not going to be here immediately available to the entire public, but we can see it. And the race is always won or lost in that last quarter line. This is not a time to stumble. If we all just work together, if we all work together over the next several weeks and go back to what we did in April, I know it was hard. I know it was very hard. It was very hard to stay away from our families. But we learned to adapt. We used tools like Zoom. We used tools like FaceTime. We used other methods of doing drive-by parties, driving by people's houses for birthday parties and the car parades. We used other methods to try to reach each other and be social beings. We are social beings by nature. It's what are those other tools at our disposal that we can use to keep doing that, but do it in a safe and responsible way. And so what I'm asking the community to do right now is to join everybody else, all of our neighbors, go back to where we were in April and the safeguards that we had in place and do that again right now. If we can do that today, we will flatten the curve. Because what we do today, we're going to continue to find cases. We have a record number of cases today. We'll see what tomorrow brings, and we have the increased number of testing. But if we all stop right now and all come together as a community and go back to doing what we did before, go back to wearing our masks, go back to being together as families through Zoom, through FaceTime, through drive-bys, through the length of a driveway, and connect in those different ways. If we all do that right now, we will flatten that curve in a matter of weeks. We can get through that in a few weeks, but we have to do it today. It has to start now.
All right, our next question and follow-up comes from WXXI's Noel Evans. Noel?
Sorry, you cut out right when you said the name, so I wasn't sure if I was up. So first question, when you talk about encouraging people to change their behavior, at the moment it doesn't seem like that's working. And I'm wondering if there have been any conversations with experts or academics on how to go about that, especially with holiday traditions.
Well, first I'd start by saying that people are changing their behavior. If people weren't changing their behavior, frankly, our numbers would be far worse than they are. But that being said, I think we need to change our behavior even more. And I think we can all share examples of how people will rationalize how getting together with this group or that group in a size of maybe 9 or 10 might be quote unquote safe. In one home, when you have that kind of a consideration, maybe that alone doesn't increase the risk. But if household after household across our community engages in that kind of calculus, it won't take very long for us to see the numbers that we're seeing. So I'm not asking everybody to drastically change their behavior. I'm asking everybody to do just a little bit more. We've got to do just a little bit more, because collectively, if we all just do a little bit more, this community will achieve a whole lot together. And so we're not changing the rules. We're not asking people to do anything drastically different. We just want people to be a little bit more thoughtful, a little bit more mindful, and to do just a little bit more.
Okay, and then follow up, and apologies for the fire truck in the background. But I understand that there is an outbreak at the county jail, and I'm wondering, given contact tracing, has it shown how it's spreading and where that spread began, or who the initial source was for that?
Well, I can talk about, I have talked to the county sheriff about this and about the safeguards that they put in place right now in terms of quarantining inmates at the jail and working with the staff and the medical professionals to keep inmates there safe. That is obviously their top priority right now. As far as contact tracing, I'll have to have Dr. Mendoza be able to talk to that.
Yeah, we can get the details on the contact tracing to you later on. But I would say that the jail has probably among the safest practices across the community. And I think the fact that we have cases in the jail, even in spite of all of the precautions in place, just goes to show how contagious this virus is. It's for this reason that I say, all professionals, law enforcement included, jail employees included, we all have to take our steps. As we dig into the details of the contact tracing, very likely it will look like any other situation where you have both staff and the residents, or staff and the inmates, who are both sharing in the responsibility of the spread, because it is just that contagious.
All right, thanks.
Okay, thank you.
Christian Garzone from WROC is next.
Hi, can you hear me?
Yep.
Yes, we can.
Hey, just a quick question. We did talk about this earlier this week. This is for either the county executive or Dr. Mendoza about the color zone designations. As you know, many businesses are reaching out saying, look, we're not the problem. This is just hurting our business. We did talk a little bit about maybe rethinking them. Is any update with that on maybe modifying the zones or maybe just shutting the county down altogether at this point?
So I've not heard any updates yet from New York State on those designations. As you know, those are set by the state. But what they did do earlier this week is laid out different criteria that they're looking at. And what they indicated is that instead of looking at simply just this positivity rate, which the triggers there were 3, 4, 5% for each of the zones. They're now going to start looking at metrics such as hospitalization rates, death rates. They'll still obviously look at the positivity rates and things like that. So what they had laid out earlier this week and indicated is that they're going to redo those metrics and then make adjustments, going forward. Also looking to see what if there were any implications from the Thanksgiving holiday and the long weekend. I think that's the right move to make, though, because I get it. This is a struggle. We have a lot of small businesses. A lot of them have not been part of the problem. I think the state acknowledged that earlier this week. And so adjustments need to be made, and I get that. And so I hope that the zones are relooked at and adjusted. But having said that, we do clearly have a problem here. The numbers are continuing to go up every day. It wasn't that long ago that we only had 100 cases a day that we're looking at. When we topped 100, that was a big deal. So there's clearly something happening here. And so, figuring out how to address that, figuring out how to slow that spread is what the state's working on right now in terms of those guidelines. Here locally, we could do I think what we're doing right now. Is we're trying to build that support from the community to do the right thing and wear your mask and follow the regulations, and then those businesses can open back up. As soon as we all as soon as we can figure flattening that curve, get following the rules, we know they work because they work in the schools, we'll be able to get those businesses back open.
Yes, indeed. Thanks so much. No follow-up. Just have a great day, guys. Thanks so much.
Thanks. You too, Christian.
All right, Brian Sharp from the DNC, you're next.
Dr. Mendoza, I know you had mentioned yesterday that I think we'll be seeing the effects of Thanksgiving weekend in the next couple of days. I don't know if this jump up into the 600s is the early signs of that, or if you think it's still going to go higher. I know you're reluctant to comment on modeling, but we're seeing now our numbers double in a matter of weeks of sort of possible, but I guess where we're headed.
Yeah, so in answer to your questions, the answer is both yes. Yes, I think that this is the beginning of the Thanksgiving surge. Yesterday was Wednesday. I think yesterday we might have started to see, Wednesday of last week. But in the coming days, I think we're going to see continued numbers from the Thanksgiving weekend. I anticipate that our total daily count will go up, no doubt. I've told my staff here in the health department to plan on an additional 100 to 150 additional cases every day. And if I'm wrong and it's an overestimate, great. But we do need to plan here in the health department. So we are anticipating certainly an increase in the community.
As a follow-up, I'm just wondering, I know Mr. Bello just mentioned the additional people to help with contact tracing, but how are you expecting to keep up with that? Or is there going to have to be a point in time where you start prioritizing where and who you follow up?
So we've been prioritizing all along. We've had to. With numbers like this, currently, if you look at the dashboard, we have something like 3,400 active cases here in Monroe County right now. And all of those individuals need calls, they need follow-up. We have nursing staff. So we've been developing protocols so that as we bring people on, we don't have to train everybody on everything. Earlier on in the pandemic, we were essentially able to float across every field and do every different task, but we don't have that luxury anymore. So I've reoriented the operations of the contact tracing unit, the isolation and quarantine unit, the testing unit, the vaccine planning unit. We have different divisions that are focused on very specialized skills so that we can train new people quickly to accomplish those skills. We have a training program in place, a way to evaluate their progress, a way to give them feedback, all of the things that are important to good performance. And, but it has become, again, very specialized, and that's the way we've been able to make this happen. And then as we look at, adopting new guidelines, the CDC yesterday announced new suggestions for how to undertake quarantine. We're evaluating that very closely. If we do that, we're going to have to restructure all of how we do isolation and quarantine so that we can, in order to do that, we have to have all of these units in place so that they can receive that new information and change their workflows. So new additional help, absolutely helpful, but we've been modifying and prioritizing all along.
Great, thanks, Brian. Patty Singer from Minority Reporter, your turn.
Good afternoon, gentlemen. Talk about quarantine, please. How many or what is the percentage of people in quarantine who have developed COVID, and how do you use that information for planning surges, anticipation of red zone, field hospital, things like that?
So when you look at the contacts, so these are the individuals who we deem as close contacts to confirmed cases. Sometimes it's hard to trace, but upwards of 30 to 40% of new cases come from that quarantine pool. So we're doing a relatively good job, and that number hasn't changed all that much throughout the pandemic, except that obviously the total number has changed. But the rest have come from the community, either through asymptomatic or symptomatic spread. Now, as to how that impacts the zones, I think that it's probably not, frankly, impacting the zones because those data aren't available, frankly, to the governor's office or to the state. All of the health departments keep those data locally. But we look at that from a planning standpoint. It tells us how we're doing with our contact tracing efforts, and we want to increase that as much as we can. It is also a measure for the community. If we're able to do contact tracing perfectly, which is a cooperation both between our department and our staff, as well as the community in either remembering or disclosing the names of their contacts, if we do a better job, we will have fewer people who develop COVID outside of quarantine. That would be the goal. But the reality is we haven't ever gotten to that point just because of how difficult it is to trace an infection that can spread asymptomatically.
So so I guess I'm curious about then how is this quarantine? So as of yesterday's dashboard, 3,400 people in quarantine. So you expect 30% of those to be active cases, and then that's just going to be adding to the numbers as they roll through Thanksgiving and Christmas. It's going to be more people in quarantine. 30% of more numbers is just more people. So I guess, is the number in quarantine a canary in a coal mine?
So let me correct you a bit, Patty. 3,400 is active cases. Those are people with confirmed COVID. So their contacts are the quarantine number, and I don't have that number off the top of my head. But yes, those people in quarantine are the people that we contact to follow them for the course of their 14-day quarantine period. And our hope is that people will abide by their quarantine. So if they do, in fact, develop symptoms of COVID, they will have already been out of circulation, if you will, out of the community, not at work, not at school, not in grocery stores and so forth. That is the goal, and it's tried and true public health. That's what we've been doing for months, and that's the spirit of contact tracing in general. But it's a collaboration between the health department and the community.
Thank you.
Thanks, Patty. Jennifer Lukey from WHEC is up now.
Good afternoon. Dr. Mendoza, I was hoping to drill down a little further on contact tracing. We talked to a gentleman who tested positive over the weekend. He still hasn't heard from a contact tracer. I'm assuming with 500 to 600 new cases a day, there is a lag there. How big is that lag now? And do you worry it's only going to get worse and then people are sort of going to escape from, the bubble, I guess? Yep.
We were behind over the weekend. We are much less behind now. We were frankly surprised by how quickly it would jump on Thanksgiving Day, I think was a jump. And then obviously over the weekend, we had the 500s. We did not anticipate that, I'll be honest with you. And so we were behind on Sunday and Monday, or Saturday and Sunday. So yeah, we are catching up. But the message I have for the community is that if if you test positive, you should isolate. We are developing workflows now so that at all of these testing sites, they have the protocol for isolation if in fact they identify somebody who is positive. We will do our best to reach everybody, but as you said, with the numbers increasing as they are, it is very hard to keep up. So what I want to say to the community is that if you test positive, you should isolate until somebody reaches out to you. If you go to get a test and it's not a rapid test, it's a PCR test that you're waiting for the results on, isolate anyway, particularly if you have symptoms. If you are worried enough to get a test because you think you might have symptoms, the better part of caution would be to isolate anyway, because you know, the last thing you want to do is get your result in 2 or 3 or 5 days later. And if you hadn't isolated, you will have potentially spread the infection to all of the contacts you'd met along the way. So our advice is if you're getting tested and you are worried in any way, please isolate.
I'm just trying to get an understanding for people, because I don't think, you know, how many average contacts does each case have? So how many calls are your contact tracers making every single day?
So the average number has always been hovering between 2 and 3 for the last couple of weeks. So for every new case, it's 2 to 3 contacts that we identify. Now that's average. Some people will say 0, and some people will give us a list. It's exceedingly helpful when we call somebody who has a list of people with phone numbers, because then we can call them right away. It's very, very easy. There are people who don't remember. You know, it's not easy to remember who you were with last Sunday at 2 o'clock, for example. So that there is some coaching that's involved there, and that's why it takes some time. And then there are frankly people, and I will say that even more than 2 weeks ago, we're seeing a lot of people who are just not interested in cooperating. We get hang-ups, we get foul language, we get very unpleasant behavior, and it's unfortunate because our hardworking staff has to deal with this. And I think it's a sad statement, frankly, of where our community is with regard to cooperation.
And County Executive Bello, one question for you, please. We've seen the testing sites, the rapid testing sites, fill up in a matter of hours. It's my understanding the Brighton testing spots are gone now. I know you said that you're hoping to continue the supply from the state. Do you have any promises from the state that those tests will keep coming to our area?
Yeah, they've made a commitment that we'll continue to receive testing kits so long as they continue to have that supply to give us. So, you know, we're going to continue to expand it, and it's a really good partnership. The amount that's available to us right now is unique. I mean, we're trying to respond to the community as quickly as possible, and I think the fact that they're filling up so quickly shows that the demand really is out there for these tests, which means I think we're pointing in the right direction here. This is a demand that the community has. It's good participation. We're finding cases, so we're steering our efforts that way. That's why, again, you know, I'll go into you know, why we're hiring these additional additional people to the COVID team is because I want to be able to continue expanding that. I think it's necessary, it's needed right now, and I also want to be able to provide additional support to the Department of Health to stay on top of the contact tracing and the investigations. So we're looking to continue that, and if you notice, they scheduled out through December beyond the initial first week that we announced earlier this week, and we'll continue to have those dates as long as the test kits are available. If you go to the website, though, there is a handy tool. When you click on the calendar, you can see which dates are available, and they're green or red. When you click on them, so you can see the time. So there's a really good handy tool there to let you know where to go.
Everything's red already.
And it's also good that, you know, we're doing the best we can with ramping these up. This is it's in my view, I'm glad that the community is participating. I'm glad that these sites are welcomed and the demand is there. So we're going to continue to work as hard as we can to meet that demand. The same thing happened at the MCC site. They opened the site with the PCR testing, and the demand filled up very quickly. As we hit the numbers that we're having now, demand filled up very, very quickly. And New York State's responding. They added 2 more lanes. We're going to continue to add sites as we go as well. We're really limited by people, manpower, and test kit availability. So we'll put every piece of manpower and test kits we have towards those types of operations.
Thanks.
Thanks, Jen. Tanner Jubinville from 13 Land.
Hi, good afternoon. Sorry to keep hitting this one, Dr. Mendoza, but want to ask another one about contact tracing. But you are mentioning that this is probably the new numbers and that are results of Thanksgiving and such. Are people, the ones who are cooperating with the contact tracers, are they saying anything about, I was with family, with friends, small group, type of living room spread on Thanksgiving? I mean, were they kind of following rules, many of them, but yet, getting infected possibly that way?
Yeah, I mean, it's I think too early to draw any firm conclusions about Thanksgiving dinner, but the stories that we're getting over the last week have been, yes, I was following the rules. We had, they'll say 12, which is conveniently a little bit more than 10. But now the spirit here is that people are trying, and it's hard. I think the reality is that this is really hard. This is really unnatural. But these little differences pay off in spades down the road if we're able to at least flatten the curve a little bit. Because if every individual in the county did their little bit of the pie to flatten the curve, we'll come out on top in the end. So I think the spirit here is that everybody's working really hard trying to do the right thing, I think. But I think we need to do just a little bit more.
And a follow-up I have for you is, yesterday we heard from Dr. Apostolakis that about 20% of the hospitalizations there are nursing home residents, at least in that system, are nursing home residents who he says are not a danger potentially to transmit the virus. They seem, they're stabilized. They could leave, but they can't because of the state rule. And we heard that there's a few dozen patients possibly in the regional health system as well in the same situation. And Dr. Apostolakis said, it's a concern because it's taking up space. We're looking at options. Can you talk more about that concern and possibly the options being looked at to free up bed space for people who need it more?
Well, so I will leave the details of how the hospitals are managing that that scenario to them. But the thinking though is that we want to retain capacity in the hospital for non-COVID care and for COVID care, but for non-COVID care as well. And it's not as though these individuals are, totally stable, ready to go. I mean, they had COVID, and generally if they're all nursing home residents, they all generally have some medical issue. So it's not as easy as black and white to say they're ready to go and everything is totally stable. But so it's really a balance of what is the right place for them to be. We also know that nursing homes represent the most vulnerable place in our community. 75% of deaths as of last week were in nursing home or assisted living facilities in Monroe County. So, we have to do our part to protect those sites. So the steps the hospitals are taking are trying to identify other locations for nursing homes to transfer their patients who may be COVID positives to a COVID positive unit, for example. So you cohort all of these individuals in one building where they're all COVID positive, where obviously the spread of COVID isn't as much of a concern as if you have a building where there are COVID negative individuals. So that's an example. These lateral transfers are an example of ways that we were trying to be creative to mitigate the stress that's put upon the hospital system from having COVID positive patients who are stable for discharge.
Thank you.
Next up is Gino Finelli from City Newspaper. Gino Finelli from City Newspaper. Are you there?
Make sure I'm not on mute. I'm good. Nope.
All right, we'll go back to Gino in a minute, and we'll go now to Kevin Oklubja from Rochester Business Journal.
This is for the county executive. Just wondering, that tranche of money that was available for small businesses grants earlier in the fall, does any of that still remain? And are you concerned that there will be a greater need again now for help for some of those businesses?
I'm very concerned about the need for these businesses. The CARES Act dollars that were made available to the county to help fund the small business grant program by law has to be spent or under contract by the end of the year. So the money can't be transferred over into the next year. I'm very concerned because coronavirus isn't going away at the end of this year. There's going to continue to be various types of shutdowns that are going to go on for the next several months. I think that's easy to predict, and we're going to see a tremendous burden placed particularly on our small businesses. There was some news this week about the federal government, a bipartisan deal reached on a COVID relief package. It's my hope that gets approved and that there is a deal in the coming weeks, particularly as we get into this new year, because the need is not going to go away here. Our small businesses are struggling to survive. And the longer this goes on without additional support from the federal government, the harder that pain is going to be. So we're working through those applications. I know that we've approved over 600 applications so far. We're still working through about half of the 2,000 applications. Needed some additional information and needed some help completing those applications. We're working through those as fast as we can, and we will get through those. I'm delighted that Congressman Morelli over the last couple of days has spoken about a COVID relief package and the need to help businesses, and he's been a great partner working particularly on the CARES Act dollars to help those businesses, and I'm hopeful that work bears fruit in Washington into the coming year.
Great, thank you.
You're welcome.
Any follow-up, Kevin?
I'm good, thank you.
Okay. I tried to get Gino in the chat with no success. Are you there, Gino? Finelli from City Newspaper? Okay, I think that's it then. Thanks, everybody.
Thank you, everyone.
Thanks, everyone. Have a good day.